Can you tell which tooth had the veneer? Actually, there was a root canal done on this tooth as well as a post and core, which gave the tooth more strength. As you can see, the tooth was sheared off right at the edge there, and there wasn't a lot of tooth structure to place a crown on. And so we're trying to hold as much tooth as possible. Now, this crown or veneer actually was done in my office, and here we are doing the root canal. We're going to put a post in to give more strength to the tooth, and the red that you see is where the blood vessel and nerve is, and we're going down to the edge of the tooth. We used an x-ray, which isn't shown on this video, for the length of the tooth, and so we know how long the tooth is. And these are our different files. You can see that there's a rubber dam, the blue, that's around the teeth, and the clamp, which is in the picture, is what's holding the rubber dam in. It's on one of the adjacent teeth. We just got done squirting in some sodium hypochlorite to clean the tooth up, and we've gone ahead and sealed the root canal, and we're into the next procedure. We're creating room for the post, and as you can see, this is the manufacturer's drill that creates a certain size hole for the post to go into. And there's the post being conditioned to allow us to bond the post into the tooth. When you bond a post like that, it gives it more strength for the whole tooth and basically returns it to the original strength. And so we put on a curing light, and this particular curing light has been sterilized, and we have one like that for every time we use it, as opposed to putting a bag over it. There's the post in place. We're placing a little bit of composite to increase the thickness of the post to give us a little bit more to hold on to. And we're doing this all at the same visit so that we can go ahead and make the crown and have that bond to the composite so that the free radicals in the composite are still active. So we're placing the composite now, bonding it to the tooth. You can see the black cord that's keeping the moisture away from the bonding area and also the gum tissue. And this is the patient. He has a class 3 joint where his upper teeth are at, because we're looking at the lower teeth, we're working on the lower front tooth. The upper front teeth are actually behind the tooth. So we're creating a little bit of space with a very fine multi-fluid finishing burr to make sure that there's enough space for the tooth to adhere to. And this is the beginning portion before we take the final preparation for the tooth. We're polishing off the top of it to make sure that it's nice and smooth. We're cleaning that up. You can see that the cord is now out, but there's still a little bit of composite around the sides, and we're going to go in and remove that composite and make the tooth more friendly in terms of causing the veneer to actually go to place very easily. And here's very fine diamond. Let's see how we go along the edges here. Clean that up. Trying to get the composite so that there's enamel or tooth structure that will be exposed to the veneer when we go ahead and cement it, as opposed to having it all in composite. And we're just smoothing that out, making sure that it's nice and smooth. We're bringing the margin down more closer to the gum tissue, staying on enamel, because the bonding of the veneer to enamel makes it stronger. And as you can tell, the part that we smoothed off was just 1/10 of a millimeter. Probably it's around 3/10 of a millimeter. Sometimes you'll do as much as 5. If it's here we are doing a little bit more. If it's a tooth that you're changing a lot of color, you end up removing more tooth structure. Now we're going to go ahead and scan the tooth and then go off to the laboratory and have it milled. We're creating space interproximally. That's what we were doing. You can see that there's a space between. This is tooth number 25. And we're cleaning off the tooth here. And we're protecting the adjacent teeth with the little metal band. I'm going to put the bonding liquid on in just a minute after everything's been cleaned up. Cure it again. More bonding liquid. Actually, that's conditioner. And it'll be all set to go. We'll put the cement. Now we're drying it off. We take the band off, get ready to cement it, and there is the initial cementation. You can see some of the composite around the edges. We've taken that off, and you can see that the tooth itself matches quite nicely. We did do some staining of the lithium disilicate, which is very strong when bonded to enamel. And we're just smoothing a little bit of it to make sure that it's not going to catch anywhere, and we want to remove any excess cement as well. We used multi-bond in this case, and it's very adherent. And there you have it.